Hi, welcome to my presentation on coping with stress. So first is our little index. We are going to go over what is stress, coping strategies, how to implement the strategies, and the conclusion. So first off, what is stress? Stress is physically and emotionally a feeling we get in a time when we're feeling unsettled. Stress can be hard to describe since it can affect everyone differently. And because one stressful event can have very different feelings or effects from a different stressor. Oftentimes, when people are stressed, they are feeling frustrated, tense, sad, angry, worried, overwhelmed, maybe confused, which can make it hard to react when you have such an overwhelming amount of emotions going on. There are 3 different levels of stress. There's acute, episodic acute stress, and chronic stress. Acute stress is short term, like stress or anxiety, maybe from a roller coaster ride. This is an example of stress of something we enjoy. Not every time acute stress is something we enjoy. It can be like you almost got into a collision. Like it's stress for a short amount of time, but then it subsides. Episodic acute stress is when the stress is more frequent, which could be seen in healthcare workers, such as like a nurse in the ER, or working in an environment like your job, per se, that has a lot of deadlines. And lastly, chronic stress. Chronic stress is long term, which can feel never ending, and it can be very hard to see a way out of it. An example of that could be a big family change, like a divorce or a loss of a job, can't find a job, or unhealthy relationships. It is important to prioritize your mental health if you are negatively experiencing stress, as it can form into depression, anxiety, and or burnout. So how do we cope with this? What do? I am so stressed out. So luckily, there are many different coping strategies. There is problem-focused strategies, emotion-focused strategies, avoidant or disengaged strategies, social support, and religion. So as stress comes in different ways, there are different coping strategies. There are several different ways to cope, those being what I just listed: problem-focused strategies, emotion-focused strategies, avoidant or disengaged strategies, social support, or religion. So problem-focused coping strategy is just as it sounds. You are trying to identify the problem and find a solution. For example, if I am stressed out about the amount of tasks I have to do that each have a deadline, I will create a list and prioritize each on what needs done first. This helps eliminate or subside that feeling of the stressor. Avoidant or disengagement coping strategies can have multiple different outlooks. First, there's active distraction, like working out or simply distracting yourself from the stressor that's present, going out with friends, anything to get your mind off the stressor. Cognitive distraction, which is putting your mind on a different issue that is unrelated to the current stressor. Denial, which is just as it sounds, not thinking of the stressor, convincing yourself that it isn't even a problem. Humor, humor, using humor to diminish the thought of the stressor. And drug use to numb the stressor or to escape the stressor. Next coping strategy is emotion-focused strategy. There are 6 different categories under the emotion-focused strategy. First, emotion expression, which occurs when you cope by expressing emotion like crying, yelling, anger, or even aggressive behaviors. Other blame, which is exactly how that one sounds, blaming others to find peace within or to avoid getting blamed. Then there's self-blame, blaming self, which sometimes is accurate and sometimes done, wrongly. And then there's wishful thinking that the stressor isn't present, and if it wasn't present, how life could be different. Passive resignation, accepting that there may be no control of the stressor and kind of coping it in that way and thinking, it is what it is, or I believe everything happens for a reason, that kind of thought process. And then there's social support strategy, which is seeking support to cope with the stressor. This can help people cope within the experiences they may have endured collectively. And lastly, religion. This is used by putting your trust in God for what is occurring, by falling back on Him to trust the events that take place. Can comfort many. How to implement. So it can be so easy to think of these strategies, but how can we implement them in a healthy way? So I put assessing the situation, identifying the stressor, identify the reaction from the stressor, learn or identify skills to cope. So dealing with stress can be challenging enough, but learning how to implement positive change or cope in a positive manner can be hard. It's easier said than done. Identifying the stressor rather than avoiding it is a great start. And then it is helpful for you to know what works on how to cope with it. Maybe it's exercise, maybe it's making those lists, or sometimes for people, it is using drugs and alcohol. If you know you aren't coping in a healthy manner, like abusing drugs and alcohol, it's probably a good time to reach out to a professional. Once you know healthy ways to cope and what works for you, it is easier to ease yourself in those stressful situations. Resources. We can seek help from a professional. Absolutely. So if you are experiencing stress and you feel like you need assistance, either because you're not coping in a healthy manner, like getting angry, which causes strain on your relationships, which develops more stress and just dives into the steep hole, or are you coping by abusing drugs and alcohol? At this point, it might be time to reach out for some assistance from a professional. But who do you reach out for? You're not sure. You would want to reach out to a mental health professional. At this point, they would be able to dive into what's kind of going on. You would give them the spiel of everything, and they would assess the situation appropriately and be that listening ear that you need. And they could also reiterate the coping strategies and how to cope in a healthy manner with some tools. And that's my conclusion. It's important to pay attention to our mental health. So once again, taking care of our mental health is priority, and something as little as stress can really pay a toll on our mental health. So coping in a healthy manner with stressors that come in and out of our lives is important. It's not something that you just should suppress or avoid. It's something that you just got to take care of and cope in a healthy way, because it's going to come in and out of your life forever. So there is my presentation. I hope it was helpful and clear. Thank you so much.